mentioned about vaccine efficacy. And in the book, you talk about the fact that vaccines can achieve one of three things or all three things, right? It can either prevent infections, it can prevent symptomatic COVID-19, or a vaccine can prevent severe COVID-19. In the middle of a pandemic, which of these aspects do you think is the most important, and how can we even compare across all the data that is coming through? Because the designs are very different, right? We saw Sinopharm in Brazil, which was looking at mild and symptomatic and gave about 60% efficacy versus some of the American vaccines, which were looking at only severe cases and were giving 94%. And all you see in mainstream media is 94 versus 62. And how do you even begin to think and wrap your hand around all of these numbers?
And it's a good question. Everyone is asking this question or thinking about it. Is like, it's almost like we now have a menu, and like you go to order a dosa, and it's like, okay, which one? If I had a choice, which vaccine would I take? And the thing is, basically, I would take the first vaccine that would be offered to me, because they are all effective to various different things that were checked. The criteria and the time point and the endpoints for each of these vaccine trials were slightly different. So you asked me what is most important, like, is it infection, preventing infection, that is the spread of the disease? Is it preventing severe disease and hospitalizations or just regular disease? And all of, or most of the primary endpoints for this were disease with secondary examination of infection or serious cases. I would say that because, so the pandemic is serious and we've had to take measures because people are dying. And I think as healthcare professionals or folks worked in allied areas, that is number one. I think we should keep track of that. As like, if we can prevent deaths, and then secondly, if we can prevent hospitalizations, use of critical care facilities, ventilators, and these long-term sequelae of long COVID or problems to the heart and lungs and things like that. And if by virtue of vaccination, we can make COVID into something like the flu or the cold, where it's like even a mild symptomatic or asymptomatic disease, then that is a win. And I think that message is also getting lost, because I've heard people who said, well, I got 2 shots, but then I heard about somebody who transmitted the disease to someone else. That's not, I think we want everything. And I think that's become a little bit of the problem. But what we have seen, I think the positive of this is what we have seen is that post some of these trials in countries that have done a very high proportion of their population has been vaccinated, such as Israel. And this information came in the last few weeks. So this is hinted at, but not in the book. What they've noticed is that the infections have also gone down. So while that was not, and this was for the Pfizer mRNA vaccine, while this was not a primary endpoint for the trial itself, we can expect that there will be a reduction in some infections. And I think that's going to be very, very helpful as we come to terms with these new variants of concern that I think people are worried about now.